Yes, hello, I'm Justin Whatling. I'm the Chair for Health at BCS, the Chartered Institute for IT.
And why is it important to have access to your online health and social care records?
It's a really good opportunity now for patients to become, and the public, to be much more actively engaged in their own health and care and their well-being and how they look after themselves, and if they're unfortunate and they are ill, what they need to do to help themselves get better. And providing access to their medical records has a lot of different advantages because it helps patients to better understand what's wrong with them and the treatment they're undergoing. But it has other benefits as well about breaking down barriers between the healthcare professional and the patient, so they can talk about their treatment plans more closely and then go and see it in the records. But it also helps because the patients can spot problems or things that are wrong in their records, and they can make those corrected. And that will be quite important if their medical records are viewed by other professionals to make sure the information is correct about them.
And why is it important to keep them safe?
So medical records, as people would expect, can contain information that could be quite sensitive and quite personal to them, obviously depending on what might be wrong with them and what's in their records. So they need to think about that and who they might want to have access to that information or not.
What are your top 3 tips for keeping that information safe?
So my top 3 tips are, I think firstly, create a strong password and keep it safe. So this is quite important because the software systems that are there do hold the patient information very securely, but your password is only good as you make it. So you need to make sure that it's a strong password and then keep it safe from others. And if people feel that their password may be known or people have used it, then you can then change that immediately and let somebody know about it. The second area I would draw out is the need to get into good habits when online. So we all use different computers these days, and you might use a home computer like a laptop, but you might also use a mobile phone or a tablet type device. So it's quite important that you get into good habits about how you look after those devices. Does it have a little PIN number you put in before you access the device? Is it up to date with the latest software for making sure that it's safe and secure? And does it have up-to-date antivirus software? Those sorts of things. And I think we'd particularly point out that if you're mobile and you're out and about accessing your patient record, just be kind of aware who's around you, because it may not be as safe as looking at it in your home environment. So you might want to choose when it's best to do that. It might be better at home in your own privacy than it is when you're out and about. And the third area is to make sure that you share records safely or not at all. And so what we mean by that is it's very good now having online access to your medical records, because it gives you a really good opportunity to share it with your family, with carers, or your care professional if you need help with sharing that information for your own care. But you also need to think about how comfortable you are with that information being shared. It may contain information that's quite sensitive to you. So have a think about the information you're sharing, and if you're in any doubt at all, then best not to share it, really. And then of course, if you become aware of other people that might have access, then best to change your password, discuss it with others. Or for example, if you're feeling like you're being forced into sharing your records by someone, then don't allow it, but go and talk to your healthcare professional about it and what to do next. So those would be the top 3 tips, which are create a strong password and keep it secure, get into good online habits, how you access information, and then thirdly, when you share your records, make sure you're sharing them safely, or think about whether you need to share them at all.
And where can you find out more information?
So you can find out more information from the NHS Choices website and also from the BCS website too.